Hi, everybody. We're continuing the stimulant or methamphetamine series, and today I want to do a little piece on the difference and similarities between cocaine and methamphetamines, and we're going to keep this discussion in terms of effects, short term and long term. We won't go into too much into the chemical structures and historical evaluation of this. As always, we try to take the scientific literature, clinical experience, distill it down for you, and give you some basic understanding of this stuff so you yourself have better tools to work with on your road to recovery or helping a loved one. We can break this down in many, many ways, but really, when you talk about cocaine and methamphetamine, uh, one of the things I'd like to point out is the effects of cocaine versus methamphetamines. Cocaine effects are 1 to 2 hours, methamphetamines 8 to 12 hours. This is really important because it lends itself to abuse and short term and long term toxic effects on the body and also susceptibility to addiction. Although cocaine has always been considered one of the most addictive drugs, I think it's not too hard to argue that methamphetamine is much worse. Well, one of these major differences is the fact that cocaine hangs around for 1 to 2 hours and methamphetamine can last 8 to 12 hours. Uh, Another thing that's important to understand with these two drugs is that methamphetamine, the withdrawals last longer, and the symptoms during the withdrawals are much worse than cocaine. These are emotional, neuropsychiatric, memory, sleep disturbances, and severe mood changes. And these are very profound and have really feed into the potential for relapse in a very, very strong way. And cocaine can have some of these, does have some of these, and for the most part, they're not as intense and they don't last as long. One other little piece that I really want to concentrate on here is the neurotransmitter dopamine. You've all heard of dopamine as it plays a central role in opiate addiction. Well, it actually plays a central role in all of addiction. It's a very important neurotransmitter in the brain, and although we don't really know and have not elucidated the mechanism of how stimulant like drugs cause, especially methamphetamines, cause euphoria, we do know that this dopamine chemical is one that is present in the brain and plays a very important role in both the euphoria and the addiction properties of methamphetamine and cocaine like drugs. Dopamine itself plays a role in body movement, thinking, motivation, and pleasure seeking. And so this is becomes sort of obvious of why methamphetamines and cocaine really have so much to do with dopamine and why it creates so much. It has a lot to do with the addictive property of these drugs. I want you to think of dopamine in a very, very simplified way. Too much dopamine causes nervousness, irritability. A person can be aggressive. They can have bizarre thoughts. They can have hallucinations and paranoia. Think about it. Too much dopamine causes nervousness, irritability, restlessness, insomnia, bizarre thoughts, paranoia, hallucinations. Doesn't this sound like some of the acute or chronic effects of methamphetamine use? Okay. Interestingly, you don't see it as much or to that extent with cocaine. Too little dopamine, what does that cause? Now think about methamphetamine withdrawals, right? It causes fatigue. It causes a very, very low mood. It causes tremors and poor muscle control. Remember, dopamine has to do with muscle control and muscle and body movement. And low dopamine causes tremors and poor muscle control, fatigue, depression, and sometimes hypersomnolence. All of these are effects of methamphetamine withdrawals. The other thing to consider here is really it's and the initial use most of the time when you think about methamphetamines or cocaine, they increase your dopamine. There's quite a bit of the pleasurable side effects and a little bit or none usually of the negative side effects. Chronic use of stimulants, whether it's cocaine or methamphetamines, and remember, methamphetamines stay a lot longer in your body and your nervous system. They're a lot more toxic and sort of additional products that are in there. So you can also imagine that it has a lot more damage on the nervous system. And so, much more so with stimulants, but chronic use damages the dopamine pathway and system. And this damage has to also do with physical damage of the nerve cells involved. And so over time, this damaged system, when initially use gave you a lot of pleasurable side effects and some of the negative side effects, over time, a damaged system, you could be potentially getting a lot of the negative side effects and some of the pleasurable side effects. So it's a really toxic, vicious, negative feedback loop. And so, worst case scenario, what you see over time is someone who's using this stuff, everything from neuropsychiatric symptoms, including memory, cognitive deficits, paranoia, delusions, horrendous sleep, horrendous mood. These are all of those negative side effects that in the beginning we were talking about too much dopamine may cause. Now long-term abuse of this system has chronically damaged. And keep in mind, the route of administration also has a lot to do with how quickly you get high, the amount of damage is done, and your abuse potential in the long run. Traditionally, if you ingest something, it's a lot slower. Then there's much more rapid routes, intravenous drug use, inhalation, and snorting. These start to go rapidly across the blood-brain barrier. So whether you're talking about cocaine or free-base cocaine, often called crack cocaine, or you're talking about different routes of administration using methamphetamine products, that also has a lot to do with it. So given some of the background I've given, going back to the question, what is some of the difference between cocaine and methamphetamine addiction? I would say clinically it's this. Methamphetamine has a lot higher propensity for abuse and addiction. Number two, because of the impurities and the fact that it's long acting and the fact that it basically puts your nervous system into sort of an overdrive, it has a lot more toxicities in the short term and long term on your central nervous system and your neuropsychiatric symptoms. I want to really give you an example of this and get you to sort of understand what it is to be doing methamphetamines. A couple of years back, there was a nice large research study done, and it essentially compared methamphetamine insults to the nervous system, the same in its structure and function as traumatic brain injury insult to the nervous system. Traumatic brain injury is just what it sounds like. There's physical trauma to your brain, whether it's a car accident, a gunshot wound, whatever it may be. And these patients can, has a wide range of presentation, whether, if you want to take the most simple and non-insulting traumatic brain injury, it would be a mild, low-grade concussion, okay? There is some injury there, and there will be long-term sequelae there, whether it's memory, attention, hyperactivity, and headaches, and so forth. On the extreme end, someone with severe traumatic brain injury might be bedridden and will need to be fed for their entire life. And in the middle of that, oftentimes people need months to years of cognitive, occupational, and physical and neuropsychiatric rehabilitation to get their life going again, and oftentimes they can't get to the same place. What's interesting about this is traumatic brain injury is really the route of events is physical insult to the nervous system or the neuron. After that, you start to get lack of oxygen and blood supply to those group of nerves and cells. After that, you get what's called cell death, and there's different types of cell death, and an inflammatory process. And the end result, and I don't want to get into too much into cell biology and some of these things, the end result of all of these insults is an inflammatory process, which is a toxic event to your cells and at the level of your genes. That's what traumatic brain injury is. And they looked at traumatic brain injury and compared it to methamphetamine short-term and long-term insult, and they saw a lot of the same microscopic features as well as neuropsychiatric, cognitive, behavioral, and emotional features. Why is this important? This is important because we don't really have any markers to define addiction. We don't have any cell markers or blood markers or protein markers to define what is addiction and what is recovery. And the idea is if we had those, we can aim towards getting to those places that we can actually have defined markers and expectations from a patient. What we can get from an idea that this is equivalent to traumatic brain injury is rehabilitation. They could use some of the same techniques and modalities of rehabilitation that's applied to traumatic brain injury to long-term methamphetamine use and abuse to get some of the same results. Some of these studies, some of this research is in its infancy, but I think it's a good place to kind of conceptually get in your mind what needs to be done and what sort of insult is occurring to your nervous system, neuropsychiatric, and mental health. Thank you very much. As usual, if you like this topic, please click on the link above to my right to see more videos. And if you are enjoying our channel, please subscribe and ring the bell.